Hi. So I am sitting in my car, obviously, because my child is sleeping, and I don't want to get out because if I get out, I'll wake him up and then he won't go back to sleep. So I have a few minutes, and I wanted to talk to you about informed consent. So what is informed consent? Because this is sort of getting thrown around out there a lot. I see my doctor friends posting about it, but I'm not really sure what people in general public that aren't in the medical field know about informed consent. So let's talk about it. This is coming up a lot recently because everyone has started to ask about a certain shot, and you all know what I'm talking about here. Okay, so the question is like, should I get the shot? Should I not get the shot? And the answer to that is not so simple, right? So you see people posting like, yes, you need to get it, or no, you absolutely shouldn't get it. I think we all have our own opinions on the shot right now, and frankly, I'm not going to tell you what my opinion is. You might be able to gather it when I walk you through the informed consent process. But from a doctor's perspective, it is not our job to tell you what to do in terms of treatment. Like, we are not supposed to tell you to go do something or to not go do something unless we feel like it's going to hurt you, or hurt you not to do it. So my job is basically to tell you what the risks and the benefits are, and what the alternatives are, and what the risks and the benefits of doing absolutely nothing are. Because the alternative to treatment for the shot is basically not getting the shot. So then what are you going to do instead? So informed consent is taking you through all of those questions. So with any new treatment, I don't care what it is that you're treating or what medication you're going to start. If your doctor doesn't tell you what the alternatives are and what would happen to you if you took it, or what could possibly happen, and I'm talking about risks and benefits, so they need to tell you about the side effects as well, or they don't tell you what the alternatives to the treatment are, then you're missing a whole bunch of options that you need to be aware of. Because the thing is, like, I don't know your body. I know what you've told me about your body, but I don't know your body. So I need to tell you all of the information so that you can tell me if your body has problems. And this comes up all the time where I tell people, okay, well, there's this, and this. And they're like, oh, no, that doesn't sound right for me because, so for example, there's certain drugs that can cause retinal detachment. Okay, that's kind of scary. It's very rare, but it's scary. And I've had people say, oh, well, I've already had retinitis. I'm like, well, then this drug's not for you, right? So, and for 99.9% of people, it's a completely safe drug, but for that person, it's not. And I would have never known that had I not told them all the risks and the benefits, and then they told me about their body, okay? So this is what we need to talk about. And like I said, this is coming up a lot because there's a certain shot going around out there that people are like either gung-ho for or totally against. And it's just not a one-size-fits-all situation. So the conversation I have with my patients goes something like this. Let's look at the benefits first, okay? So the benefits of getting this shot are that the chances of you getting severely ill have been reduced, and that's assuming that you're healthy enough to mount an immune response to this certain therapy. And if you don't have a healthy immune response and you can't mount antibodies in response to this stimulus, then the shot isn't going to work for you. It's not really going to do anything at all. So how to decide whether or not you have that is like a really long conversation that I'm not going to get into here. But basically, the healthier you are, the better chance you are, the better chance you have of actually responding and mounting the antibodies that you need to protect yourself from this virus. Okay, so that's benefit number one. The other benefit that is sometimes touted is that you then can't spread the virus. Okay, that's false. So I'm just going to say that right now. That is completely false. The fact is we don't actually know if it prevents the spread. As far as we can see, it looks like it does not. So basically you then become an asymptomatic spreader, which means that you still get the virus. It's still in your system. It does not prevent you from getting it at all. You're just not having symptoms. So you don't know you have it. So then you don't know you're passing it on. Okay. So that's sort of the benefit. That's kind of a risk too, because if you have high risk people and you might be reducing your load, but you're not necessarily preventing spread. Okay, so that's something that's really important to think about. Okay, so then the risks of not getting it are that, well, okay, so you're more likely to then get more severe symptoms. So let's talk about what we could do to reduce that. Okay, so if you're already semi-healthy, and like, remember I said, if you're pretty healthy, you're more likely to respond positively. Well, if you're healthy, you're more likely to not have severe illness anyway. So then the question is, well, what is the benefit? Is there a benefit? Because if 95 or more, it's closer to actually like 99% of people are not going to have severe symptoms, then what is the actual benefit, right? So if we're that 1%, and that 1% might not even be healthy enough to respond to this shot, then like, what is the actual benefit for them? Like, is there really one? So this is a question that I think people need to seriously think about. Okay, so there are some risks. So let's walk through the risks, and then you can kind of make a decision if it's right for you or not. So the risks are that it has adjuvants in it, and these adjuvants are a big deal. So we're talking heavy metals, we're talking preservatives, and for certain people, especially in my patient population that tend towards autoimmunity, these adjuvants are very dangerous, and they actually can stimulate additional autoimmunity. They can stimulate, like, so this is where we get into that world of like stimulating autism and past, God, I can't even think of another word to use, but you all know what I'm talking about, the V word, right? So past ones have caused autism and Guillain-Barré and like all sorts of these like horrible muscle wasting diseases. The one that we're giving kids for HPV, that one is horrible. It causes this like chronic fatigue illness that is like untouchable. I mean, I've never seen anything like it. I've treated people with this, and I can tell you that, like, I mean, after treating them for years, like nothing ever made them better. And I know what I'm doing in terms of treating chronic illness and chronic fatigue, because that's my specialty. So we're talking irreversible damage for some of these people that, you really need to strongly consider whether or not you're in that boat. Because if you're a high risk person, then I would say I would take my chances with the virus, right? Because we know how to we know how to stimulate our immune systems against a virus. At least I do. And so that is where we get into like, what could you do instead? So you could get yourself really, really healthy, which looks like controlling your blood sugar. So blood sugar dysbiosis, that's in your gut. Blood sugar dysregulation. That is a huge risk factor for developing immune like inflexibility and poor responses to certain infections. Basically, when your blood sugar is spiking, your immune system is dropping. So every time someone goes through a blood sugar spike, their immune system gets suppressed, and that allows all of the other infections in your system to come out and play against you. And my phone keeps wanting to shut off, so I'm sorry. So the point here is that there are things you can do to stimulate your immune system. So balancing your blood sugar, right? Building muscle mass, because muscle mass protects you. And eating really healthy foods. And I mean that in like, we need all the nutrients we can. So like, if you don't have access to healthy food, then you need to be on like a really good multivitamin type supplement and immune support. And if you don't know what immune supportive vitamins are, I suggest you Google it or go find yourself a doctor that can help walk you through it, so that you feel really confident that you are supporting your immune system. And social interaction. Okay, we've like shut everyone down and taken away their social networks, and people are crashing. Like kids are committing suicide at like the highest rates we've ever seen. Alcoholics are going crazy because suddenly they're like stuck in their house with nothing to do except drink, and the liquor stores are open. So we need to talk about like mental health and how that affects your immune system. Obviously your outcomes are going to be much worse. The reality is like, and if you don't know this, if you don't know that you're going to get exposed to this virus at some point in time, then like you're missing something huge. Like, we're all going to get this. It might not be tomorrow, but it's going to happen because it's a coronavirus. And now, and there, I said it. Okay. I said it. Because it's a common cold, and those viruses don't go anywhere. Like, it's going to be around forever, and it's going to spread, and it's going to keep mutating. And it's gonna be in our society for the long haul. So if you don't get it now, you're gonna get it sometime in the near future. So you might as well prepare yourself for that now. And if you want to get the shot because it makes you feel better, because you're scared, then that's fine. That's okay. That's definitely something that people are doing, and if that reduces your stress load, then that's a very real benefit. Even though I would consider it more of a placebo benefit, I'm not against prescribing things that are placebos. I just think you need to consider the risk factors of it as well at the same time, because if you don't consider the risk factors, you're missing half the story, and you're frankly putting yourself in danger. Okay, do I like any glucose monitors? Yeah, I mean, really any glucose monitors. So the Libre Free or whatever is one of those continuous glucose monitors. I think it's like $60. Those ones are great because then you don't have to prick your finger all the time. It's gonna like sync with your smartphone, and it'll tell you if your sugars are spiking. Sometimes people's sugars spike in response to foods that they would never think foods that you think are healthy. Oatmeal, for example. Some people can't digest oatmeal and their sugars spike like crazy with it. And that's one of those foods that your doctors might tell you to eat to balance your blood sugar. So this is why in a lot of my talks, I always stress the importance of eating for you, because eating healthy food might not be healthy for you. You really have to figure out what your body can handle and what your body can't handle. So yeah, glucose monitors are great. Heart rate monitors are great. Listening to your body is great. Like, you don't need any fancy tools. You just need to keep a journal, and you need to pay attention. So skin rashes, bloating, stomach aches, headaches, menstrual pain, joint pain, nail issues where you get little like fungus, or you get little nicks on your nails, or ridges, things like that. Allergies, those are all signs that you have inflammation. Basically, any symptom you have, if you're writing it off, you're doing yourself a disservice, because those symptoms are your body telling you that something is imbalanced, and you have to figure out what that imbalance is, or it's going to keep getting worse and worse and worse. Okay, so I went off on a little tangent there. Ridges are like the bumps on your nails. My nails are painted, so I can't show you, but like if you have lines or your nails are kind of like bumpy, they really should be kind of flat and clear, and you should have moons. I'm not going to get too much into nails, but they typically indicate either mineral deficiency or like adrenal stress. Sometimes it can be psoriasis or autoimmune. So there's quite a few things that can happen, but basically if they're there, it's abnormal. Okay, my kiddo's awake. I gotta go. Thank you guys so much for listening. Drop any extra questions you have below, or send me a DM, and I will answer them as soon as I can. Okay, bye.